Introduction. Alprazolam is a benzodiazepine medication primarily used to treat anxiety and panic disorders. It works by calming the brain and nerves. It is a prescription-only medicine due to its potential for dependence and misuse. 2. Brand names. Xanax. Xanax XR. 3. Drug class. Benzodiazepine. Central nervous system, CNS, depressant. 4. Mechanism of action. Alprazolam enhances the effect of GABA, gamma-aminobutyric acid, a natural calming chemical in the brain. It increases GABA activity at GABA receptors, leading to reduced anxiety, sedation, muscle relaxation, anticonvulsant effects. 5. Indications, uses. Generalized anxiety disorder, GAD. Panic disorder, with or without agoraphobia. Short-term relief of anxiety symptoms. Sometimes used off-label for insomnia and depression-related anxiety. 6. Dosage, adults. Anxiety. Initial dose, 0.25 to 0.5 mg, 2 to 3 times daily. Maximum, usually 4 mg per day. Panic disorder. May require higher doses, up to 10 mg per day in divided doses, under strict supervision. Warning: dosage must be individualized and gradually adjusted. 7. Pharmacokinetics. Rapid absorption. Onset, 30 to 60 minutes. Peak effect, 1 to 2 hours. Half-life, 11 hours, average. Metabolized in liver, CYP3A4. Excreted in urine. 8. Side effects. Common. Drowsiness. Dizziness. Fatigue. Dry mouth. Memory problems. Serious. Respiratory depression. Severe sedation. Confusion. Depression worsening. Suicidal thoughts. 9. Warnings and precautions. Risk of dependence and addiction. Tolerance may develop with long-term use. Withdrawal symptoms if stopped suddenly, seizures, anxiety rebound. Avoid alcohol, increases sedation risk. Caution in elderly, risk of falls. 10. Contraindications. Acute narrow-angle glaucoma. Severe respiratory insufficiency. History of substance abuse, relative contraindication. 11. Drug interactions. Alcohol, increases CNS depression. Opioids, risk of respiratory depression. CYP3A4 inhibitors, e.g., ketoconazole, erythromycin, increase alprazolam levels. Other sedatives. 12. Pregnancy and lactation. Category D, risk of fetal harm. May cause neonatal withdrawal. Not recommended during breastfeeding. 13. Storage. Store at room temperature, 20 to 25 degrees Celsius. Protect from moisture and light. Keep away from children.